Steeply rising medication prices in the United States have become a growing concern within the community as pharmacies and manufacturers have managed to increase prices by 98.2% from 2011 to 2016 alone. To better understand this drug price issue, pay attention to the example of insulin. In the past, it has been recorded that the listed price for the life-saving drug insulin has risen 600% since 2002 till 2019. It has also been noted that the exact same vial of insulin is being sold for $30 in Canada, while being sold for $300 in the United States for no apparent reason of price increase. These irregular changes in drug prices affect lower-income families and patients buying specialty medications that help save lives, such as EpiPens, insulins, cancer medications, and more, that tend to cost more. People have to deal with the stress of debt, planning to pay for basic needs along with other amenities. Family time is reduced as parents are forced to work more than one job and have to cut down on quality time with the family, such as going to the movies, restaurants, and more, as it has been reported by many families to news reports in order to afford medications. If nothing is done, then people will be forced to turn to legal imports of cheaper drugs and rationing prescribed medications. Polls show that 3 out of 10 US adults already don't take prescribed amounts of medicine because of the expense. Watch this TED Talk that references a West Health Gallup survey result.
Including in wealthier countries. 34 million Americans have lost a family member or a friend in the last 5 years, not because the treatment didn't exist, but because they couldn't afford it. Rising drug costs are pushing families into homelessness, seniors into bankruptcy, and parents to crowdfunding treatment for their critically ill children.
The TED Talk talked about how loved ones can be lost and community conditions can worsen if nothing is done about the issue. What can the communities do to help out? Watch this PSA to get some solutions.
To deal with high drug prices that affect many people in the community needs to come together and demand for more generic brands. Generic drugs are the same as most brand name drugs but cheaper, which is better for suffering lower income families. Community needs to show a preference to generic drugs, so the FDA fast tracks its approval and helps families out.
While the community and media work to bring more attention to the matter, government needs to take action and set price capping policies. Big Pharma get most of its profits through investors. However, investors tend to sell stocks upon facing an increased regulation, which will force Big Pharma to regulate prices. In conclusion, this madness of capitalism based on health will continue to destroy families unless steps are taken by the government and the community. This topic is very significant because health is something that cannot be controlled, not when regarding hereditary or life-threatening diseases in general, and everyone should have the opportunity to have access to medication to stay healthy without having to work 24 hours for the medication bill.